Okay, this video is atrial fibrillation part 2. I did a previous video about atrial fibrillation recently. And so this is basically what happens if the patient goes for cardioversion and cardioversion fails. Basically, if you get atrial fibrillation and it's, first of all, you can try to avoid all the causes. And if you avoid all the causes and you optimize your blood flow, low fat, low sodium, vegan and all that, no alcohol, no caffeine, etc., you might be able to reverse it and keep it reversed and be done with it. That would be ideal. Preventing it in the first place is best. But, AFib begets more AFib, and the more chronic it is, the less likely it's ever going to go away completely. If it's persistent, despite avoiding all the standard causes, and, go through I had a checklist in the previous lecture. If it's persistent, you can go to your cardiologist and they might be able to cardiovert it, okay, and get you back into a sinus rhythm. The longer the delay to cardioversion, the more likely it's going to fail. If cardioversion fails, you can treat with antiarrhythmic drugs. There's pros and cons of doing that. You can even just treat with rate control medications like beta blockers, calcium channel blockers, and also anticoagulation, something like apixaban to reduce the risk of stroke. You can consider an ablation procedure. You go to an electrophysiologic specialist, EPS doctor, especially subsection of cardiology, and they can kind of put catheters inside you and try to burn some of the so-called negative unfavorable conduction pathways in the heart and try to improve conduction. That's a long procedure. It can take as long as 6 hours. It works better in younger patients. There's a risk of significant side effects, even death. So again, this is, by the way a lot of stuff is in medicine. If you just prevent it, it's kind of easy to prevent. Once you're stuck in the disease, the more chronic it gets, the more you're stuck with all these problems that might never go away. So same old story, reduce ischemia and you're less likely to ever end up in AFib, as well as avoid all the things that cause it. I'll link the previous lecture to this one. So anyways, hope it's helpful.